Now, to sustain change, you're also going to need changes in thinking and behaviors. So to give you a little example of what our organization is like, we are a two-site community hospital serving a global community. And we've got 3,700 staff, more than 700 physicians, 800 volunteers. We provide acute care, chronic disease management, and ambulatory services. We've got one of the shortest wait times in the emergency departments in GTA at our Roosevelt campus, and the largest nephrology program in the entire North America. So we're quite a diverse and large organization. This is our team. Most of them are sitting on this table right here. And we've got a team that also has a diverse background. So some of us come from a clinical background, some of us come from engineering, many of us have our masters, or we've come from private enterprise, consulting, healthcare, and some are even new graduates from their master's program. So we leverage all of those skills to ensure that we can best support the organization. So I'm going to show you a little video that demonstrates some ways that you may have experienced, you may have done yourself, some tactics on how to sustain changes in an organization.
Good boy, Daddy's so proud. Oh, you're so cute. Yeah, keep going. Good job. High five, buddy. High five.
We have a module online that we want you to sign up for and complete. And at the end of it, there's a small test that once you're complete, we consider you trained for this module.
Please, could you just try me? Please. Please. Go on.
So we've been asking you to do this particular process for a while now, and we're still seeing some struggles with this. So I know you're interested in that leadership program. We might be able to get you in that if we start to see some improvement. No? What about your performance? 50%? Yeah. Come on, alright, that's not that's very nonsense. Let me see if we can next one.
Here's a new process. First you do this. Then you do that, and then you do this. So just to make it clear, here's a process map of how you do it. So first you start here, and then you do that, and then you come here, and then you do this, and then you go there and you do that, and then you're done. Capiche?
So, Mr. Potato Head, it's been brought to my attention that you have not been following the process. I've asked you repeatedly to do this, and I'm sorry, but now I start to show you what happens to people that defy me. So these lovely ladies are going to demonstrate what happens.
So there is a better way, and we're gonna pass it on to Kim to talk about how we actually use this tool called a quality check card.
So, I'm here to tell you, we've done all of those things at Scarborough Hospital, and I think many other healthcare organizations as well. Sustaining change is one of our greatest challenges, and one of the common themes that we hear from our clinicians at the front line is, oh, it's the flavor of the day, oh, try this, and things tend to fall off the map. But there is a better way to do things, and that's the quality check. And this is a visual tool that we've been using, and it tells us how to audit a process, and it gives us real-time feedback on how we're performing to standard work. At TSH, we've actually used the quality check for 3 years. We've been on our lean journey, and we've used this many times. And how we use the quality check is we can use it to assess how we're sustaining the change that we've implemented to address a gap in practice, how we are performing to a new change that we've implemented, quality check example that we bring to you today is actually a pretty special one. We implemented this across our organization, and we actually had to do this because we had a little problem. And our problem was, we went through an accreditation process, and we were found to not be meeting a required organizational practice. And what this practice is, it's called 2 times every time. And every time a clinician performs any type of intervention with a patient, you're to check the individual's identity by 2 identifiers. And so when we went through the accreditation process, we were found to not be achieving this required organizational practice. And so we brought this to you to show you how we were able to make a big change and actually meet the accreditation standard. So what we have here is a card, and it's it's green and red. And what we would do is every day, when we have our daily huddle or safety huddle or team meeting, is a team member would be assigned to do the quality check. And essentially what it is a mini audit. And each unit decided on a threshold for how many of these audits they would do in a day. And it's usually was about 3 to 5 that they would have to do. And it's the process of the audit, it's meant to be very, very fast. Because you have to remember, we're asking clinicians to take time away from patients to do this sort of work. And so it has to be easy and it's got to be fast. And so an individual would be identified every day. And they would be given the card, and on the card it actually describes what it is you need to do in order to complete the audit. And what we're auditing for is how we're adhering to the standard work for the quality check. And so the card is very self-explanatory. It was very easy to teach this shift over shift over shift. We were able to sustain it on weekends as well. And we were able to track the process to how we were performing. And so if we were good, we were green, and then actually be shown for the day, and if we were not able to meet our standard work, then we would be red, and then that would be shown. So I'm just going to turn it over to Natalie, who is actually superwoman potato, and she's going to tell you the next step in the process.
Okay, so what is the calendar? So what's the quality check calendar? It's a visual tool, just like the card. And what it shows or monitors, it monitors trends and patterns of the quality check. So at a quick glance, anybody in the organization can walk by this calendar and see what we're monitoring and how well we're doing. At the top of the calendar, you'll notice that the month and the unit department is displayed, and on the left is the names of the quality checks we're monitoring. For instance, the example Kim had mentioned, 2 times every time would be written there. The quality check is tracked either daily or weekly. And first we track daily because we want to make sure that we're trending in the green. And then we may decrease the time to a weekly check. The person who has completed the audit will color the section red or green in accordance with the color of the card. So remember that the quality check calendar is just a piece of paper. So in order to include the staff in discussions, we ask them questions. So how do you feel about our progress? And whether this quality check should remain on the calendar. The quality check remains on the calendar for however long it takes to see the trend remain at green, and that may take 1 week, 1 month, 2 months. So what do we do with a quality check that remains red for a period of time? And that's when we do a deeper dive. And for this presentation, we won't go into it. Quality check card can be filled out, or can be monitored again for a period of time, even once it's been removed. So we may bring it back a month later. The implementation of quality checks in our organization has been instrumental in many ways. The one that stands out to me is during accreditation Canada when they arrived and asked us for information in relation to the 2 times every time. So unbeknownst to us, we had been saving these calendars, filing them away. No, we're not hoarders. But in this case, the calendar provided proof. For instance, 2 times every time, which was a required organizational practice, in black and white. The proof was in black and white, but in this case, it was really red and green. And so the quality check calendar saved the day.